गुड इवनिंग, माई सेल्फ डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के सम इम्पॉर्टेंट एमसीक्यू। व्हाट इज़ द नॉर्मल पोर्टल वीनस प्रेशर? 5 to 10 mmHg is the best answer because the normal portal pressure is 5 to 10 mmHg or 10 to 50 cm of saline. Next question. A 63-year-old male with known liver cirrhosis comes to the emergency department with bleeding per rectum 4 days. He had variceal banding after an episode of esophageal bleeding 2 months ago. Non-tender abdomen with positive shifting dullness and normal bowel sound on examination. There is a grade 2 plus peripheral pitting edema. Burn and serum creatinine are raised. Urine dipstick is negative for protein and blood. Urine sodium is 5 mg per liter. Which of the following is the most likely diagnosis? Here the best answer is the hepatorenal syndrome. The hepatorenal syndrome क्या होता है? Here the patient with the history of liver cirrhosis present with an abnormal renal function test and most likely the hepatorenal syndrome diagnosis. Hepatorenal syndrome is a developmental of acute renal failure due to severe hepatic or biliary disease. Hepatic or biliary disease. Often with jaundice. It is defined as the reversible functional renal impairment in the absence of other causes of renal failure, tubular dysfunction, proteinuria, or morphological alteration in the histological studies. Here the precipitation factors are reduced renal perfusion, GI bleeding, vomiting, sepsis, excessive diuretic use, and glomerular pressure and NSAIDs used for the constrict afferent arterioles. Next question. A 45-year-old man presented for hematemesis and hematosia. An urgent upper GI endoscopy showed multiple esophageal varices, mild portal hypertension, gastropathy, and no gastric varices. Which of the following agent is recommended for variceal bleeding? Octreotide. Because for managing variceal bleeding, somatostatin analog and octreotide are the agent of choice. Somatostatin analog and octreotide. It should be initiated at the onset of variceal bleeding. Combination of octreotide and endoscopy therapy is more effective in controlling bleeding and is preferred treatment for the most patient. Octreotide dose कितना होता है? 50 microgram as loading dose IV and 50 microgram 1 hour in 5% dextrose as maintenance dose. Next question. What is the likely type of varices in a patient with esophageal varices that involve the lesser curvature of the stomach? Type 1. Sarin classification is the most commonly used classification for the esophageal varices. Type 1 is the gastroesophageal varices and type 2 is a greater curvature of the stomach. It extends from the esophagus for the greater curvature of the stomach, and this one is the type 1 lesser curvature of the stomach. Type 2 greater curvature of the stomach. Type 3 is the isolated. Type 3 isolated gastric varices. And in the gastric varices occurs in the fundus and there is an absence of esophageal. Here होता है absence होता है esophageal varices. Absence होता है esophageal varices. Type 4 also isolated gastric varices in which any part of the stomach is involved, like the stomach antrum होता है, body and pylorus होता है, but esophageal varices are absent होता है, but esophageal varices are absent. Mark the correct statement. Here the mesocaval shunt is a selective shunt. Not ischemic fistula is a selective shunt. No, ischemic fistula is a non-selective shunt is a best example because the shunt may be selective, non-selective or partial shunt. Ischemic fistula is a type of non-selective shunt. It is now absolute now, and in mesocaval shunt is a non-selective, and this one also non-selective. Distal Ini-Cetimportant is not selective scent. This one is the selective scent. So today that's all, and thank you. Keep watching.